The adult heartworm, Dirofilaria immitis, is an important cause of canine and feline illness worldwide. In dogs, serious complications arising from heartworm infection include pulmonary hypertension, pulmonary thromboembolism, respiratory distress, right heart failure, and even death. Heartworm is increasingly recognized as a serious problem in cats, with signs such as dyspnea, coughing, vomiting, and sometimes sudden death. The heartworm life cycle includes a vector mosquito, host animals, namely dogs and cats, and the heartworms themselves. The cycle of heartworm infestation begins when a mosquito bites an infected animal, ingesting first-stage larval heartworms called microfilaria, which have been deposited in the animal's bloodstream by a fertilized adult female heartworm. In the mosquito's Malpighian tubules, the microfilaria develop into second and third stage heartworm larvae. The third stage larvae then migrate to the cephalic spaces in the head and proboscis, ready to be transferred to a new host when the mosquito next feeds. The whole process takes approximately 2 to 4 weeks, depending on the environmental temperature. When the infected mosquito next bites a dog or cat, the third stage larvae are transferred into the new host when the mosquito feeds. As many as 10 L3 heartworm larvae can be transmitted by a single bite. Once transferred, the larvae establish themselves in the tissues of the host. Within a few days, they begin molting into fourth stage larvae. After 2 to 3 months, these stage 4 larvae molt again, this time into young adult heartworms. In dogs, the immature adult worms migrate into the circulatory system, ultimately residing in the pulmonary arteries and, in heavy infections, the right ventricle of the heart. Here, the worms finally mature and live out their lives, sometimes as long as 5 years. And the cycle begins again when the fertilized female heartworms deposit microfilaria into the host circulatory system, from which a mosquito feeds and then infects other susceptible animals. In dogs, heartworm infestation can cause symptoms which range from no visible illness to coughing, difficulty breathing, lethargy, and weight loss. Severe cases may result in right ventricular enlargement and increased pulmonary vascular resistance, right heart failure, respiratory failure, or even death. In recent years, heartworm disease has become recognized as an increasing problem in cats as well. Because cats are resistant but susceptible hosts to heartworms, feline heartworm disease is more difficult to diagnose. In cats, heartworms are less likely to be present in the right ventricle of the heart. They are more commonly found in the pulmonary arteries of the lung. Cats often present with signs of coughing, respiratory distress, or vomiting. For this reason, feline heartworm infection can be confused with feline asthma or may mimic clinical signs of many other feline diseases. Cats harbor a lower worm burden than dogs, and the worms are smaller. However, the results are just as serious: lung injury, respiratory distress, and sometimes death. Now, heartworms no longer need to be a threat to companion animals, either dogs or cats. Revolution provides 100% efficacy in preventing heartworm disease with its first application. A single topical dose of Revolution provides sufficient tissue concentrations to effectively prevent heartworm disease in both dogs and cats. Revolution interrupts the heartworm life cycle by killing L3 and L4 larvae in the tissues of the prospective host. Revolution has a unique mechanism of action. It binds with receptor sites on the larva's L-glutamate-gated chloride channels. This causes the larva's nerve cells to lose their ability to respond to excitatory nerve impulses. The heartworm's muscles become paralyzed and the parasite is killed. This effectively breaks the heartworm life cycle and prevents heartworm disease in the potential host. In clinical trials, 100% of the animals tested were protected when Revolution was given at the recommended monthly dose. A single dose remains effective despite bathing as soon as 2 hours following administration. Revolution's margin of efficacy is great enough to be effective even if inadvertently a dose is skipped or only a half dose is applied. Because of Revolution's unique mechanism of action, it is safe for use in both dogs and cats. Revolution can be safely administered to heartworm-positive dogs and cats, collies with a demonstrated dose-dependent sensitivity to ivermectin, pregnant and nursing females, and breeding males. Revolution is so safe that it can be used in puppies and kittens as young as 6 weeks of age. Revolution is generally well tolerated. In studies, less than 1% of dogs and cats experience digestive upset. Approximately 1% of cats experience temporary hair loss at the application site. Use with caution in sick, weak, and underweight animals. Now, there's no need for dogs or cats to be vulnerable to heartworm disease. Revolution breaks the heartworm cycle reliably, safely, and conveniently.